our webinar, An Over-the-Counter Birth Control Pill is Coming, Building the Legal and Policy Framework for Insurance Coverage and Accessibility. We'll begin the webinar in a few minutes. Thanks for your patience. Hi everyone and welcome. Thank you for joining the webinar today. My name is Elise Powell and I am the Reproductive Rights and Health Program Assistant here at the National Women's Law Center. Could everyone in the audience please type into the chat if you can hear me, just to make sure everything's working well with the sound? Okay, looks like we're getting some good signs and everyone can hear. Great. So a few technical notes before we begin. All attendees on the line will be on mute today during the webinar. We'll be taking questions after our experts are finished with the main presentation, and we encourage you to submit questions through the webinar. You can submit a question by typing it using the GoToWebinar chat window visible in your dashboard, which can usually be found on the right side of your screen. This webinar, we're having some technical difficulties with the live captioning, so hopefully midway through we'll get the code that we need to start the closed captioning, but it should have closed captioning, and you'll be able to see that at the bottom of your screen, so don't be alarmed if that pops up somewhere in between. Lastly, the webinar will be recorded, and as a registrant and attendee, you'll receive the links to the recording of the presentation as well as the slides within the next few days. And actually, the slides should be available now in the handout portion towards the bottom of your screen. So at this time, I'd like to turn the floor over to Mara Gandel-Powers, Director of Birth Control Access and Senior Counsel at the Law Center.
Hi, everyone. Thank you so much for joining us today for our webinar. We've been working on this project with the support of IBIS and the OC-OTC Working Group for over a year, and we are really excited to share what we've learned and some ideas for moving forward into the future. And as Elise said, we're going to have next slide. We're going to have Q&A at the end, so I really do encourage you, as those questions are coming to you throughout the presentation, please put them in there, because I know sometimes they may, go in and out as you're listening, or something else may pop into your mind. So please do put those in. And if we see them coming in during the presentation and they are clarifying, we will try to catch those as we go through. So what we're going to cover today, we have joining us Mary Durden, the Communications and Outreach Manager for IBIS Reproductive Health, and she's going to be talking a little bit about the history of the Free the Pill movement and where things are with the movement to bring a pill over the counter. And then we are going to talk from the Law Center, myself, and Vasharia Tutson, our legal fellow, are going to be talking about the federal landscape for coverage of an OTC pill, state-level possibilities, and how to start laying the groundwork for an OTC pill that really meets our vision for what it should look like when it's here. Before we get started, though, we wanted to give you a quick reference for some of the acronyms that will be coming up today. And as I say on here, we're sort of sorry we have so many acronyms, but not sorry because it makes it a little bit easier. We know that hearing and saying the phrase over-the-counter oral contraceptive over and over again is repetitive for you and for us. So here we have some of the phrases you'll hear us saying. It's totally fine if you want to stop for a second and take a screenshot of this. If some of these are new to you, and you can refer back to that while we're going through the webinar, that is totally understandable. And another point that we wanted to make up front is that we are really striving to use gender-inclusive language throughout this webinar. So you will often hear us saying people who need birth control or people who use birth control, but at times you may also hear us say women, particularly when we're referencing data or studies that may have only included cisgender women. And we really fully recognize that trans men and non-binary people also use birth control, and an over-the-counter pill may have particular advantages for those individuals. So we want to intend this to be very inclusionary, but there may be times where you hear gendered language. And with that, I'm going to turn it over to Mary Durden from IBIS Reproductive Health, who is going to talk more about the movement to bring an oral contraceptive over the counter.
Hi, everyone. I'm excited to tell you about Free the Pill, the campaign to make a birth control pill available over the counter. So birth control gives us full control over our sexual and reproductive health and lives, but there are too many barriers to access them, and it's time to free the pill. Next slide, please. When we say over the counter, we mean available directly on the shelves. In the US, you need a prescription from a healthcare provider to get the pill. In some states, pharmacists are able to prescribe the pill or healthcare providers can prescribe it online, but the pill is safe enough to be available without a prescription or any unnecessary gatekeepers. We know that it isn't enough to just be available OTC. A future over-the-counter pill must also be affordable, covered by insurance, and available to people of all ages. Next slide. This isn't a novel idea. In fact, the pill is available over the counter in over 100 countries around the world. Next. Free the Pill's story starts with the Oral Contraceptives Over-the-Counter Working Group, a coalition of advocates, researchers, and healthcare providers who've been working together since 2004 to support this effort with the goal to improve access to contraception for all, especially those who currently face barriers to access, by registering a safe, effective, and low-cost OTC pill. Next. A large focus of this work included developing the evidence base to free the pill. These are 3 key findings from over a decade of research. First, the prescription status for the pill serves as a barrier. OTC access may lead to higher rates of initiation and continuation, and people can accurately self-screen for conditions that can make taking the pill harmful or less effective. Next. Some barriers to obtaining a prescription include the unavailability, time, and cost of a doctor's appointment, not being able to take time off of work or school, and not wanting a pelvic exam. From additional research, we've learned that nearly 1/3 of women who have tried to get a prescription for a hormonal method have faced difficulties, and that the challenges were greatest among Spanish speakers and uninsured women. Next. Over the years, we've garnered many voices in support to free the pill. Major provider associations such as the American College of Obstetricians and Gynecologists and other leading associations in women's and adolescent health support making the pill available OTC. Additionally, over 90 organizations have signed on to the working group statement of purpose. Next. In a recent nationally representative study, we found that 4 in 10 women and 3 in 10 teens would use an over-the-counter pill. Additionally, 1 in 4 women and teens not using a birth control method would try an over-the-counter pill. Next. So how can this happen? The most likely scenario is that one of the many formulations of the pill would move OTC one at a time. For each type of pill to go OTC in the United States, a drug company will have to submit an application to the U.S. Food and Drug Administration, also known as the FDA. We already know that the pill is non-toxic and not addictive. The FDA also requires a series of other research studies that can ultimately take about 3 to 5 years to complete. Next. We are proud to say that we're in the middle of that research through our partnership with HRA Pharma, and we could see a birth control pill available over the counter within the next few years. Next. Meanwhile, we'll be working with our partners to ensure that once it's available over the counter, it will also be covered by insurance. One part of this includes our partnership with the National Women's Law Center, outlining this legal and policy framework for insurance coverage and accessibility for a future OTC pill. And we're all excited to see what they found. And with that, I'll turn it back over to Mara.
Thanks so much, Mary. And so I think it's really important. One of the things that we've been really thinking about and keeping sort of at the center of our thinking as we've gone through this legal research and thinking about what this looks like in the future is keeping the vision for an OTC pill at the center, right? And so I'm reiterating here what Mary had on her slide, but OTC, affordable, covered by insurance, and available to young people, right? And those are the last two things really what we're focusing on in particular in our research. And we know that an oral contraceptive over the counter will not truly be successful if people can't get to it because of cost or other barriers, right? So public and private insurance have to fully cover an OTC OC, and we have to make sure there aren't other barriers like refusals to provide it in the way. But we also know that our healthcare system is really fragmented. There's so many different types of coverage that are regulated by the federal and state governments, as well as programs that assist individuals in affording birth control if they don't have coverage. So there really isn't a one-size-fits-all solution for coverage and availability of an OTC OC. So, we started thinking, okay, federal level, what do we need to think about? And there's a few key pieces to really think about. One of them is the Affordable Care Act's birth control benefit, and it requires coverage of all FDA-approved birth control methods for women without cost sharing. But for over-the-counter methods, plans are still allowed to require a prescription to get that coverage. We know that about 62.8 million women have insurance coverage that has to comply with this benefit. So what happens with this benefit and OTC products is really important. We think about Medicaid. And Medicaid pays for 75% of all publicly funded family planning. So how it treats a future OTC pill is really important as well. But we know that right now, coverage of OTC products, birth control products, varies from state to state. And then we also think about programs like Medicare and TRICARE. Medicare provides really critical coverage for many people of reproductive age with disabilities, but it does not have a requirement that birth control be covered at all. Now we know that Part D, which is Medicare's prescription drug coverage, does cover a lot of prescription oral contraceptives for most people, but an OTC pill would probably face some challenges there in terms of coverage. And TRICARE provides coverage to service members and their families, but it has very specific requirements about coverage for OTC products, and they still require a prescription for those OTC products. So I think the picture I've painted here is, there's some clear challenges to coverage of an OTC product, but there are some very clear paths to making improvements on these requirements and programs. But I think it sort of goes without saying that the current administration is likely not to be receptive to the kinds of proposals that we would put forward to improve coverage and access to an OTC, and it's probably not where we're going to see real progress in the short term. And as Mary alluded to earlier, the states are really some of the most promising areas to work towards guaranteeing coverage and ensuring access to an OTC. I think a lot of us have heard the phrase, states are laboratories, and that really is the case here. And I think we have a real opportunity to make coverage and availability really work right now in the states. Some states have already taken the steps to improve coverage and access to current OTC birth control products. But for the most part, we've seen some of this movement in more progressive states, and those models might not seem accessible to everyone. But really, our vision, when we're coming back to that vision that we are keeping central, accessibility to everyone, we need to make sure that coverage and availability becomes a reality for everyone, everywhere across the country. So as part of our project, we did in-depth research on the current landscape for OTCs in Colorado, Illinois, Louisiana, Pennsylvania, and Tennessee. And we really were thinking a lot about what needs to be done in those places and then taking lessons learned from those states to think about what could happen everywhere. So with that, I'm going to turn it over to Visharia Tutson, the Law Center's legal fellow, who, as I said, has been really in deep on this research, and she'll talk a bit about what we did and what our lessons learned are.
Thanks, Mara, and hello, everyone. I hope you're having a great day. So when we talk about the vision, the reason there's a mountain on the screen is because you really want to think of yourself as working your way up to the vision, which is everyone having access to birth control with no out-of-pocket costs. With insurance or without insurance, people are able to access some form of method of birth control and the method of their choice, which is also very important. So we want you to understand the process of working your way up the mountain. And just because you aren't at the top now doesn't mean that you can't make a difference in your state as you push through the barriers that Mara and Mary have talked about to ensure that the OTC pill will be covered and accessible. So when you look at these 7 factors, I want to stress that there's no specific order to follow. You could definitely get in where you fit in for your state. These factors are reflective of how people pay for contraceptives, where they're able to access them, and the laws that create additional barriers. We really want these factors to help guide advocates on how to approach laying the foundation in their state and the types of research or questions you need to focus on. However, this list is not exclusive, and there are definitely other factors to consider. And really, when you think about your state, you also know that there's other factors into play that maybe aren't these 7, but also will dictate the path you have to take to getting the OTC pill covered. So through my research, I have learned that there is not a one-size-fits-all model. Some states could have a great contraceptive equity law, but no Medicaid expansion. Some states have great family planning programs, but no contraceptive equity laws on the books. This is really just to say that it's a balancing test for these factors of consideration. You want to know what coverage does your state have, how can that be improved, knowing that there's these factors at play that could make one path a little harder than going another way. Painting a full picture of your state's landscape will help you set up the potential barriers now, so in a few years when the OTC pill enters the market, people in your state can actually access this pill using their insurance coverage with no out-of-pocket costs. So now we'll return and discuss each of the factors and their role in addressing potential barriers down the road. So for this first factor, when you're assessing where your state's starting point is, understanding the relevant contraceptive coverage laws is a good place to start. This will show you where the work needs to be done to guarantee insurance coverage of all contraceptives, including over-the-counter birth control. Originally, contraceptive equity laws were used to require insurance plans to cover prescription contraceptives if the plan covered any other prescription drugs. Now, thanks to the Affordable Care Act, more states are passing comprehensive contraceptive equity laws that include things like 12-month dispensing, no cost sharing, and over-the-counter coverage. Thinking about everyone's point about the state landscape is more ripe for change, it's really important that every state passes a contraceptive equity law that mirrors the birth control benefit, because this administration is attacking the Affordable Care Act and women's health. You want to ensure that the residents in your state can get the health care they need without out-of-pocket costs, no matter what's going on in the White House or HHS. The goal is to one day reach the vision of contraceptive coverage that addresses the barriers individuals face every day, whether it's paying for birth control, getting to the pharmacy, or getting to their local doctor's office. Thankfully, the Affordable Care Act has raised the bar, but there is still room for opportunities for the states to fill in the gaps and make a difference for all individuals. Illinois is a great example of a progressive contraceptive equity law. It applies to all individual health plans and group health plans in the state. There's no cost sharing. It includes over-the-counter contraceptive coverage for drugs, devices, and products. And as an added bonus, their 12-month dispensing law also covers over-the-counter contraceptives. You know, the state is pretty much ready for the over-the-counter pill if it enters the market tomorrow, but there is still room for growth. So just because they have this strong law, there is still work to be done on the ground, because the goal is to strive for the vision, but getting any of these additional benefits is still a win. So if your state just wants to codify the birth control benefit on the Affordable Care Act, let that be step one, and then next session try to push for 12-month dispensing. So when we're thinking about contraceptive coverage, you want to remember the Medicaid population. Contraceptive equity laws typically affect coverage for people with private or employer-based insurance, but there are a lot of people who have Medicaid and they deserve to have the same access to affordable contraceptives. Coverage here means the most because the cost barrier for this population can have a serious impact. The over-the-counter pill's purpose is to offer a more convenient method that any person can access whenever they need it. But often, traditional Medicaid programs do not offer the full range of methods, and we have learned from the emergency contraception fight that over-the-counter access can be difficult. Currently, only a few Medicaid programs offer EC coverage without a prescription, and this is a sign that your state might need to do a lot of work to get the OTC pill not only covered, but covered without a prescription. Keeping in mind that this pill is made to be over-the-counter and should not require a prescription, which leads to a doctor's office, which is just another man-made barrier in between someone accessing the pill when they need it. There's a lot of space to do proactive work with your state's Medicaid program to start moving towards comprehensive contraceptive coverage. Consider Medicaid expansion, family planning waivers, or other state programs similar to the LARC for Colorado program, but try to fit in the over-the-counter method to continue the narrative that everyone should have access to the method of their choice and not just one particular method that maybe your state favors, but keeping in mind that everyone has a choice of what they have access to. When you're trying to pass contraceptive coverage laws, don't forget about Medicaid and try to extend the same coverage like 12-month dispensing and over-the-counter coverage without a prescription. Pennsylvania is a good example of a state that's doing great work in Medicaid, but that does not have a contraceptive equity law on the books. It's about understanding the climate in your state and what's the best route for your state and improving contraceptive coverage to cover all methods one day, including the over-the-counter pills. Medicaid expansion and Pennsylvania's family planning program is great because people under these programs are entitled to the same contraceptive coverage as people with private insurance because of the Affordable Care Act. In Pennsylvania, some of these improvements were started by the governor, who was extremely supportive of birth control and directed the state health department to start programs like the Medicaid LARC training to improve access in the state. Overall, Pennsylvania is taking steps in the right direction, and your state could do the same. Now that we have talked about private insurance and state health programs, let's talk about over-the-counter drug coverage. The main goal is to have over-the-counter contraception be covered without a prescription, meaning that you can pick up the pill off the shelf, go to maybe your pharmacist counter so they can run the claim, and then you are able to get your over-the-counter pill without any out-of-pocket cost. The vision is to have a seamless process where even one day if the pharmacy is closed, someone could get their pill for free under their insurance without any hassle, considering maybe one day could be at a 7-Eleven next to the condoms. If your state already has a contraceptive equity law, this might have to be a standalone bill. But if your state hasn't passed one, make sure you try to slide in the over-the-counter contraceptive coverage in there. It's important that the OTC coverage language is broad as possible to include future methods that maybe are not out in the market yet. So we want to encourage people to really shoot for the stars when advocating for over-the-counter coverage. Delaware is a great example of that for Mara and I. Earlier this year, we worked with Delaware to pass a contraceptive equity law, and we met resistance when pushing for broader over-the-counter contraceptive coverage language. So, no, we didn't get everything we wanted, but getting EC covered without a prescription is still a pretty big deal. So now advocates in Delaware have a great starting place for next session to keep pushing for full over-the-counter coverage of contraceptive drugs and devices. Moving to the next factor, until your state enacts over-the-counter contraceptive coverage, pharmacists prescribing contraceptives is another alternative to getting around the prescription barrier. A state would need to expand the scope of pharmacy to include prescribing and dispensing contraceptives. Usually this can be done through regulations through the pharmacy board, but this can also be a legislative fix. The key is to use broad language to expand the scope of pharmacy so that pharmacists are able to prescribe current and future methods of contraception. This is where you want to be creative in the language so you can leave a lot of room for interpretation on what type of methods can be prescribed. This leads me to point out California, which is at the forefront of pharmacy prescribing. Currently, their law has very broad language, which includes 4 different types of methods. California is now at the stage of implementation, which is teaching us a lot of lessons on the timing and the process of getting this system off the ground. So you still can't walk into any pharmacy and get a prescription for contraception. It takes time to implement pharmacy prescribing because it requires changing the regulations, training, and also providing some type of incentive for pharmacists to take on this extra responsibility. Considering all the steps for implementation, give your state time to get ready for the OTC pill by starting this process now. This is a great gap filler also for folks on Medicaid in states where over-the-counter coverage is not an option. Now we're turning to factors that have been used to deny people access to healthcare in general, but more specifically that have a history of being used to attack access to birth control and abortion. Considering that the OTC pill will be new to the market and may cause some commotion because of the concept of it being over-the-counter and accessible to minors and everything else they say in between, some legislators or corporations might use religious or moral beliefs as their basis for not supporting the pill. This factor is extremely important because we are seeing an increased use of Religious Freedom Restoration Acts, commonly known as RFRAs, being used in litigation to attack women and LGBTQ rights. RFRAs exist on the federal and state level. The federal law was originally created to protect individuals who experience discrimination because of their minority religious beliefs. Minority in the context of religious beliefs that aren't as common or acknowledged by like federal or corporate holidays. It was used to shield people who held these beliefs from employment discrimination, but over time it has been turned into a sword. There are still a number of states that have RFRAs. Some track the federal statute language, and some are broader and give more protections to religious objectors. When it comes to RFRAs, no RFRA is a good RFRA. And I mean that we have not seen a RFRA used in a context that uplifts the groups of people because it's used to justify discriminatory behavior. You may have heard this administration use phrases like religious liberty, religious freedom, but it's used in a context to allow people to refuse providing healthcare services, deny birth control coverage, or even make a wedding cake. It's very hard to see how a third party's religion, sometimes even a corporation, can outweigh and justify denying another person's rights. When it comes to contraception, the RFRA can be used as a springboard and connected to other statutes that can be used as a justification for discrimination. At the federal level, this law was used to challenge the birth control benefit. To give more context, the infamous Hobby Lobby case is a prime example of how RFRAs are being used as a sword against birth control. In 2015, the National Women's Law Center published a report highlighting entities and individuals alike which have attempted to use this decision in alarming new ways and expanding the reach of Hobby Lobby to try to deny the rights of others. We are now currently working on an update for this report because the fight against birth control has continued and there are new cases and other types of rights still being attacked by using RFRAs and the Hobby Lobby decision. We definitely will let you all know when the report is finished. Overall, to protect individuals in your state from this type of discrimination, it's important to understand the current laws that exist and how they can be used as a shield or a sword, especially in the employer context. You always want to keep RFRAs in the back of your mind and think about how to navigate around them in your state. Moving to the next factor, pharmacy refusal laws are the type of laws that can be used in conjunction with a RFRA. Pharmacy refusal protection laws should ensure that the patient can get their contraception and that the pharmacist's religious beliefs are respected as well. But after reviewing several states' pharmacy refusal laws and regulations, there's a trend of one-sided protections for the pharmacist's beliefs and do not provide a system to ensure the patient will still receive their contraception. But let's put this into context. We know for a fact that people are being refused healthcare services in their doctor's office, their hospital, pharmacies, and even on college campuses. Especially in the current political climate, where this administration is encouraging people to use their religious beliefs to discriminate, we need to make sure that there are laws in place to protect patients and people trying to access healthcare services. These laws are a little tricky to understand, and Pennsylvania is a great example of a pharmacy refusal law that has a lot of room for interpretation when we're thinking about the over-the-counter pill. In context of the over-the-counter pill, the pharmacist would only be required to run a benefits check, not to dispense the contraception because it's over-the-counter and should be on the shelf and not behind the counter. But looking at this language, I would encourage all of you to look at your state's law and see how you can close the loopholes to ensure that patients are being protected and will receive the services they need regardless of their pharmacist's beliefs. In the process of making sure your state is ready for the OTC pill, you want to problem solve before these situations arise. Learning from the issues consumers face when trying to get EC over the counter, we want to encourage advocates to be proactive in anticipating the barriers in their state. If you know your state had or still is facing placement issues or age restrictions around EC, think about how you could prevent the same arbitrary barriers for the over-the-counter pill. So now that we've reviewed most of these concrete factors, I hope you can see how each factor can play a significant role in coverage and accessibility of the over-the-counter OC pill. You can have a few factors in your favor, but if the climate on the ground is not friendly for proactive birth control work, that could really be a problem when you're trying to lay this foundation. So this last factor of understanding the climate on the ground in your state can help you tie all the factors together and prioritize first steps. When considering where to start in your state, the reproductive health landscape is extremely important. We all work in coalition to lift each other's work up, and you just want to be aware of what your other partners are doing on the ground and how your efforts can best be used. You definitely don't want to step on anyone's toes or maybe push forward a law that maybe could not be so helpful for litigation on the ground. So that's just, a type of example of things that you want to be aware of what your partners are getting into, even though it might not necessarily be under your bucket. But if there's an appetite on the ground to do work, then take advantage. If there are state legislators or the governor who expresses interest in expanding birth control coverage, use these factors to determine the best starting point and build from there. You want to find champions who are willing to go to bat for your legislation and support the over-the-counter pill. However, if your state is currently maybe battling Medicaid payments to clinics that provide abortion, or there's RFRA lawsuits on the ground that are protecting discriminatory actions, you maybe might need to be a little more cautious and think of things that you could do in the background that will still push your state in the right direction. And that's like hinting towards maybe it's not a legislative fix, but it's something you could do through the regulations. Lastly, we really learned a lot from the over-the-counter switch for the EC fight. And that was not too long ago, honestly. From that experience, we can anticipate some barriers that might be created, like age restrictions, placing the pill behind the counter, ID checks, sign-in laws, and et cetera, anything you can think of in between. You really want to do your research on your state and see what were some of the common challenges brought and how they were addressed, if at all. If there's a pharmacy that still doesn't place EC in the right area, that's something you want to know and anticipate. Overall, I hope you have a better understanding of how each of these factors work together, can influence the work, and push your state to the top of the mountain to get the vision of comprehensive contraceptive coverage.
Thanks so much, Visharia. So I think hopefully everything Visharia has said has sort of like sparked some thoughts in your mind about what the best, inroad is for you. As we said, there's no one size fit all, but this is sort of a chart that we've started working with and thinking about the coverage factor, the accessibility factor, and legislation or regulations or guidance that you could push forward or think about in your state as a way of taking that next step towards building up to the vision. This, I have to say up front, this is proactive ideas and actions. It's certainly not an exhaustive list, but based on our research, we think these are sort of the high value investments that you could make in legislation or guidance or regulations. And it doesn't touch on some of the defensive work that's going to be necessary as well, particularly in states where the political climate maybe isn't as favorable to women's health or birth control in particular, so around RFRAs or pharmacy refusals. And it certainly isn't a substitute for your knowledge about what you already have in your state and the landscape that you're dealing with. We think this is a really good tool to sort of like guide you through thinking about where the inroads are. Go to the next one. And I think one of the things that we have started thinking about and wanted particularly to share in this webinar is, you know, what you can do now if you're still figuring out what your inroad is to getting to the vision of how you can sort of inject OTC into how you talk about birth control, women's health, and insurance now that's going to serve you well over the long term. And so sort of when we're thinking about do's and don'ts, we're thinking about like not really messages per se, but when you're talking about OTCs, right? So we think it's important, and this is something we really embrace here at the Law Center, is people should have access to the method of their choice. And so when you're talking about birth control in general, OTC methods are part of that spectrum. And sometimes we do, you know, you may meet resistance from folks saying they aren't the most effective, you know, they still have out-of-pocket costs now. And, you know, from my perspective and from our perspective, that's not on us to decide. We want to make sure every person who needs birth control has the method that they pick. So talking about OTCs in that context, I think is really important. And I think one of the things that I point out on the slide here is that, you know, when you're doing that, you may end up doing a little bit of sex ed about the range of methods, because we know that there's a lot of people who know about the pill and know about condoms, but they don't know much about other methods that are out there. So you may end up having to do a little bit of that. One of the things that we think can be helpful is talking about some of the arbitrary limits that insurance companies place on coverage of birth control already. So really planting that seed to say, oh, 3-month limit on dispensing, that's sort of arbitrary. It's kind of, you know, an insurance company does that for their own purposes. It's not, you know, how women think about how long their prescription lasts for, which is generally a year, and it's arbitrary. And we think talking about those arbitrary limits could be helpful in the long run when we're thinking about the future, where some plans may want to require a prescription for an over-the-counter product. It's a limit that they're placing on it that's not appropriate, not in line with what the FDA recommends, and we think that starting planting those seeds now about arbitrariness would be helpful. And also, as Visharia was mentioning, knowing the OTC landscape where you are, right? Knowing about EC, knowing about, are there other OTC products that are out there? I think a good example is, you know, are people aware about the internal condom? Is it available OTC or is it still prescription? How is that working where you are? And so I think that's a really important thing. And also, you know, so we have a shorter list of don'ts, which I think is easier, but, you know, don't repeat the myths about an OTC pill. As Mary sort of alluded to up front, it is safe. People know how to use it. People can self-screen to see whether they are eligible for it. And there's a lot more data. If you go on the Free the Pill website, you can get a lot more answers to those frequently asked questions so that you aren't repeating those kinds of myths unintentionally. And I think the biggest don't that I would say is don't compromise on the vision for birth control coverage, right? This is sort of where we started. We're circling back to it, but for everyone, right? And I think in particular for young people, as Mary highlighted at the beginning, everyone needs access to this pill once it's over the counter. And so, you know, you may come across someone who says, oh, I'm a little uncomfortable. You know, if you need help figuring out how to get comfortable yourself with talking about that, that's what, you know, we're here for. That's what the folks at Free the Pill are here for. And we really want to not compromise on that vision, particularly when it comes to coverage and access. And so with that, let's see, let's go to the next. We would love to take some questions and give you some answers. I'll give a minute to see if anyone's typed anything in.
It looks like we do have a couple of questions from the audience. Just a reminder, if you have a question, to type it into the chat function, and we'll do our best to answer all of them in a timely manner. As a reminder, we are recording today's webinar, and we will send a link to the recording, and you guys already have the slides available to you now. So give us a moment to pause and read through some of these questions, and we can get some answers to you guys.
Hi, so we had a really good first question, and the question is, can someone without insurance get access to OTC pills? And I think, we sort of alluded to this in our chart of like places you could do inroads, but, we really focused on insurance coverage and physical accessibility. I think one of the things that obviously there are populations of people who are uninsured or who don't want to use their insurance for birth control or other services for a variety of reasons. And I think the vision that we have, and that Mary, you can chime in on this as well, but the Free the Pill has, is that this pill will be accessible to everyone, whether you have insurance or not. And part of that may mean helping to support programs at the state level that provide support to folks without insurance coverage for getting an OTC pill. In that situation, the location of getting that pill may be a little different. It may not be, at a pharmacy. It may be, I would love to see an innovative program that supports that. But I think the vision is that it is affordable for everyone. And ideally, for those with insurance coverage, it's treated exactly like every other product. Mary, is there anything you want to chime in with on that?
Yeah, sure. I think, yes, if it were available over the counter, that means it would be over the counter, or should be available over the counter like any other over-the-counter product, not only like emergency contraception, but other over-the-counter drugs that exist today. And as I mentioned earlier in my presentation, that the people who face the greatest barriers to accessing birth control because of the prescription requirement are people who are Spanish speakers and also people who are uninsured. So it's really vital that people who don't have insurance have that kind of access, and that is one way to approach this.
Thanks so much. So another question that we sort of were combining a couple different questions, but I think, Mary, you might be well positioned to answer this, is in terms of the FDA, which pill are we particularly talking about? Are we talking about all pills? Like, how does this part of it work?
Yes. So in order for any birth control pill to be available over the counter, it would have to be, we believe it would have to be one application at a time for each formulation, and there are dozens of formulations of birth control pills, and we are specifically looking and applying for a progestin-only pill to be available over the counter. And so the working group spent several years coming to consensus that we would pursue OTC availability for a progestin-only pill. And we believe that all birth control pills are safe, combined pills and progestin-only pills, but POPs, as we call them, progestin-only pills for short, are the safest option for the broadest population. There are very few conditions that might make using a birth control pill unsafe or make it less effective. And EC, emergency contraception, is already a progestin-only contraceptive available over the counter, which leads us to believe that FDA approval of an over-the-counter progestin-only pill would likely be faster and more direct. And so, yes, there's many formulations of POPs and COCs, so it's not just two of them even, but formulations of both of those forms of birth control pills.
Thanks so much. I'm going to throw another one your way, Mary. So we have a question coming in. How can we address doctors who call POPs, the progestin-only pills, quote, subpar contraception and are not interested in making them OTC?
Yes, that's interesting. We have a lot of support from doctors overall. We're supported and have statements written by doctors and medical societies, as I mentioned before. And there are some doctors who will say exactly what you just said. And for that, I think POPs are as effective as combined pills. That's what the data show. And furthermore, we are doing research at IBIS Reproductive Health specifically on messaging directed towards healthcare providers and doctors about POPs, because we know that those concerns exist overall. And so when that research is available, we'll definitely be doing a lot of outreach to let people know what messaging is most effective about POPs to convince them that POPs are a great contraceptive option, and if they were available over the counter, they would be the most effective over the counter birth control method. And let's see. I have one more thing I wanted to say about POPs. Oh, yes, and that POPs in the US are less popular, but that POPs are used around the world more broadly. And so I think that that is a particular US perspective that need not exist elsewhere.
Thanks, Mary. We had one question about pharmacist dispensing and prescribing, and someone said, I know for California you said all 4 methods. Does that include other methods beyond the pill, like the ring, etc.? And it's going to depend on how your state writes those laws and what methods are included. Sherry, I don't know if you want to chime in on that.
I mean, California has a very broad one, which is why they are such a great example, because they cover like the ring, patches, the pill, and I think injectables too. Those are the 4 methods. So they say hormonal contraception. Like some states just say oral contraception. Some states just say EC. So you want to move your state away from using a specific method and using language that can encompass more than one method, because you want this to help increase accessibility, and increasing accessibility is increasing the amount of methods that people can get at one place.
Thanks. And I think we have time for one more. Oh, we've got 2 more questions down here. How much do you think it would cost consumers should the pill be approved OTC? So I think there's 2 parts of that question. One, would it cost consumers who have insurance coverage, and if the insurance is working, what I would want to say is $0, right? I think most people should have that coverage. That's the standard these days. Without coverage, paying cash, I know I can't answer that, and I think it's probably a question for the pharma company that my sense is they probably wouldn't answer at this point. But Mary, I don't know if you have other things you want to say about cost.
Sure. So we have at IBIS done research on what people are willing to pay to access a monthly pack of birth control pills. And we see that estimation being between $10 to $20. And research like that is something that we provide to the pharma company. It's already available so that they can see because the pharma company wants to sell their product, and people aren't going to buy it if it costs an exorbitant amount of money. And so we're continuing to do that research and plan advocacy efforts for years out to think about what advocacy we can continue to do to make sure that the feature over-the-counter pill is also affordable. And we also, within our relationship with the pharmaceutical company, made sure that there were specific affordability programs that they were committed to pursuing within their work once it's available, in addition to planning out when a generic version could possibly be available as well.
Super. Thank you. So one last question we have, would a vaginal ring with progesterone only be an attractive option over the counter? I guess I would say from my perspective, I think in some ways the more methods the merrier, I guess. Right now the ring is a combined hormonal contraceptive, and I think a different kind of delivery system would be great for progesterone only. I recognize that it takes a lot of work to get a new product to market, but I think it sounds like something really interesting. Mary, I don't know if you have thoughts on that too.
Yeah, I agree that the more methods, the merrier, and that, the working group has been doing this work since 2004, and it's true that it takes a very long time to get to that point. And I would also say that a future over-the-counter pill being available, since we're closest to having a pill be available over the counter, could potentially open the doors wide open for more methods to be available over the counter. So not only more birth control pills, more combined birth control pills, but I think that it would start a trend of eliminating those unnecessary gatekeepers as well. And I think not only with more birth control methods, but like, let's talk about abortion pills being available over the counter too. And I really feel that this work really starts with Free the Pill.
Yeah, definitely. So that's all the questions we have. Sort of in terms of what's next for you listening to this webinar, or you're thinking about what's happening in your state. I would say first thing, if you are not already following Free the Pill on social media, they've got their Twitter handle, their Facebook page right up here. I would really encourage you to follow them. You're going to get updates with new things and you know, just interesting stuff along the way as this process moves forward. If your organization is not yet a member of the OC/OTC working group, there is a statement of purpose that you could sign on to. It'd be great. We would love to have, I know they would love to have, we're a member of it, but we've signed on, but you know, more groups would be fantastic. We know that this is you know, of interest to folks, so if you haven't signed on, please do. We, the Law Center, are making a toolkit based on our research, and we will obviously circulate that when it's completed to everyone who's been on this webinar, but it will have a lot of the resources in here, talking points, you know, where to think about, what factors to start with in your state. So make use of that. And I've also put up here our email addresses and contact information. You know, if something comes to you after the webinar, or you have a comment or a question, we would love to talk about it. And with that, I would love to thank you so much for joining. This will be recorded, so if you have folks you want to share it with, please do. And thanks again. Bye.
Thank you.